Do you experience painful periods, fatigue, or digestive issues that seem to get worse around your menstrual cycle? For many women, these symptoms are dismissed as just another part of life, another bout of PMS to be endured. But for some, these discomforts point to a much more complex and often misunderstood condition: endometriosis. Endometriosis is a chronic inflammatory disorder that affects millions of women worldwide. Yet it remains shrouded in mystery and often goes undiagnosed for years. To truly understand its impact, let's start at the beginning. What exactly is endometriosis? At its core, endometriosis involves tissue similar to the lining of the uterus, known as the endometrium, growing outside the uterus. Instead of staying within the safe confines of the womb, these rogue cells can take up residence on the ovaries, fallopian tubes, bladder, intestines, and even other organs in the pelvic cavity. Each month, just like the uterine lining, this tissue responds to hormonal changes. It thickens, breaks down, and bleeds. But unlike normal menstrual blood, which exits the body, this misplaced tissue has nowhere to go. The result? Inflammation, pain, and the formation of scar tissue, or adhesions, that can bind organs together and cause lasting complications. Endometriosis is far from rare. It's estimated that about 1 in 10 women of reproductive age are affected by this condition. Yet, because its symptoms often mimic other common health issues, it can take years, sometimes up to a decade, for a woman to receive an accurate diagnosis. During this time, the condition can quietly wreak havoc on daily life, relationships, and even fertility. So, what are the hallmark signs of endometriosis? The list is long and varied, but some symptoms stand out. Perhaps the most well-known is pelvic or abdominal pain, especially during menstruation. For many, this pain is far more intense than typical period cramps, sometimes so severe it disrupts daily activities or leads to missed work or school. Heavy or irregular periods are also common, as are bouts of fatigue that linger for days. Pain during or after sex can be a distressing symptom, impacting emotional well-being and intimacy. Some women struggle with infertility, finding it difficult or impossible to conceive. Others notice pain during bowel movements or urination, especially around their period. Added to this are general feelings of bloating, nausea, and malaise. Importantly, the severity of symptoms doesn't always match the extent of the disease. Some women with extensive endometriosis experience little pain, while others with milder forms may be incapacitated. With such a wide range of symptoms, what causes endometriosis? The truth is, the medical community doesn't yet have a definitive answer, but several theories have emerged. One leading hypothesis is called retrograde menstruation. This occurs when menstrual blood flows backward through the fallopian tubes into the pelvic cavity, rather than leaving the body. These displaced endometrial cells then attach to pelvic organs and continue to act as they would inside the uterus. Another possibility involves the immune system. In some women, immune dysfunction may prevent the body from recognizing and destroying endometrial tissue growing in the wrong place. Genetics also play a role. Having a close relative with endometriosis increases your risk. Hormonal imbalances, particularly an excess of estrogen or insufficient progesterone, can create an environment where abnormal tissue is more likely to thrive. Finally, environmental factors, such as exposure to endocrine-disrupting chemicals like BPA or phthalates, may also contribute to the risk. Living with endometriosis can be challenging, but there are effective ways to manage the condition. Medical treatments often begin with pain relief. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, can help reduce inflammation and ease cramping. Hormonal therapies are another cornerstone of treatment. Birth control pills, hormone patches, or specialized medications that regulate or suppress estrogen production can help slow the growth of endometrial tissue, reduce bleeding, and alleviate pain. In more severe cases, surgery may be necessary. Minimally invasive laparoscopic procedures allow doctors to remove or destroy endometrial lesions, providing significant relief for many women. For those struggling with infertility, assisted reproductive technologies, like in vitro fertilization, may offer a path to pregnancy. But medical interventions are only part of the story. More and more women are seeking natural and holistic approaches to help manage their symptoms and improve their quality of life. Diet plays a crucial role. Adopting an anti-inflammatory eating pattern rich in leafy greens, berries, fatty fish, turmeric, and flax seeds, while minimizing red meat, dairy, processed foods, and refined sugars, can make a noticeable difference. Gentle, regular exercise, such as yoga, Pilates, or walking, can help reduce inflammation, improve circulation, and ease both physical and mental stress. Nutritional supplements like omega-3 fatty acids, magnesium, curcumin, and zinc have shown promise in reducing inflammation and supporting hormonal balance. Heat therapy, including heating pads or warm baths, offers simple, effective relief for cramps and muscle tension. Alternative therapies, such as acupuncture and pelvic physical therapy, are gaining recognition for their ability to ease pain and improve pelvic health. And of course, sleep and stress management are vital. Chronic stress and poor sleep can disrupt hormones and intensify symptoms, so mindfulness practices, deep breathing, and guided meditation are well worth exploring. With all this in mind, is it possible to prevent endometriosis altogether? While there's no guaranteed way to stop the condition from developing, certain lifestyle choices can help lower your risk. Focus on maintaining hormonal balance through a nutrient-rich diet and regular physical activity. Avoid environmental toxins by steering clear of products containing BPA, phthalates, and synthetic fragrances. And pay close attention to your body, track your symptoms, advocate for yourself at medical appointments, and seek help if you suspect something is wrong. Early detection and proactive management are key to minimizing the long-term impact of endometriosis. If you or someone you love is navigating life with endometriosis, remember this: you are not alone. Your pain is real, and you deserve answers and relief. Don't hesitate to reach out to a trusted healthcare provider. Keep a detailed record of your symptoms and explore the range of medical and natural options available. By educating yourself and advocating for your health, you can take control of your journey and find the support you need. If this information has helped you understand endometriosis a little better, consider sharing your story with others. Your experience could offer comfort and insight to someone else going through a similar struggle. And remember, knowledge is power. Together, we can break the silence around endometriosis and empower women everywhere to seek the care and understanding they deserve.